before 2015, Zika outbreaks occurred in Africa, South America, South Asia, Southeast Asia, and the Pacific Islands. And it was in 2015 that we started hearing the stories in Brazil and South America. As I said, it is transmitted by a mosquito bite, and it can go from a pregnant woman to her fetus. It can be transmitted by sexual contact, and it can also be transmitted in blood transfusions, so serious consequences. The symptoms are relatively mild, so it would be fever, rash, joint pain, and red eye or conjunctivitis. It can also be headache and muscle pain. Only lasting from 3 days to a week, but as I said again, it can have serious consequences. It is still important to remember that only about 20% of people who get this virus have symptoms. So most people won't even know they have it. So that's why if they've been in areas where Zika virus is endemic and largely affecting that country, that they need to practice how to prevent mosquito bites, how to avoid that. If our county has an identified case of Zika virus, that not only will we be counseling that individual about how to avoid mosquito bites, but we may need to move very rapidly in terms of adulticide spraying. And that would mean actually in a 150-yard to 200-yard radius. So one can think of an entire block and an adjoining block that will need to have adulticide spraying. So we want to put the emphasis really in terms of the prevention and what we can do individually, because I know there are some strong feelings either way about spraying in our county. But this is a situation we don't want to see, those fetal malformations and brain damage. But that could come, and that is a situation where the state of Maryland, if they have that information, they will notify me, but they will quickly move to do that. And even though resources are limited, we do want to contain the spread of this virus. I felt it was important for me to demonstrate
You're making a statement.
how we should be dressing in the summer as we enter mosquito season. So
Wow.
that it's long
Okay,
sleeves,
everybody get a picture of
shirt
that.
and pants,
All right.
pant legs and socks. I hate to dress this way, but I tuck the shirt into the pants.
I know.
Okay?
And I think we're going to have to be updated. Things seems to change really quickly. I mean, I remember looking a few weeks ago, and the map was pretty scarce, and the map is not scarce. Almost the entire country is blue, except like the middle of the country and maybe North or South Carolina. I forget which one of the two. So the travel-borne stuff is everywhere, and I guess the question is are the projections that the mosquitoes that have it and that where it's locally born, are they likely to migrate up from the south where it's warmer and make their way up the coast? I mean, I've seen different discussions about this, and it seems like that people are going to need to know it early on. So what do we know about?
The maps thus far show that the Aedes albopictus has been able to travel further north than the Aedes aegypti. And when I say further north, the map now goes up to New York State. So it's more that eastern seaboard south and going upward. So that is a possibility.
I want to start off with something that I think is important that you had just mentioned, which is regarding the pesticide ban that Montgomery County has and the potential need for doing some sort of spraying. And I did just want to highlight to the public that may be watching that Section 33B-10 of the bill does cite that should there be some sort of a public health need, as that you could apply for a waiver to do whatever you needed to do. So I just wanted to assure the public that may be watching that that's already in the bill, and so that's there to protect our public health. But I did have a question for you. As an active Red Cross blood donor, as a person who goes in quite frequently to donate blood, how has the Red Cross been in terms of keeping up with being able to screen for Zika virus? And so that's my first question to you.
I cannot speak about the Red Cross specifically, but I do know that the CDC has been working with a number of organizations in terms of what needs to be done in screening our blood supply for Zika. They actually had to work on, what sort of tests can detect Zika in the bloodstream. But when I mentioned that this is possible to be transmitted by blood transfusion, that's because there have been studies looking at it and what we can do to make sure that it's preventive.
I'd like to understand if spraying is warranted. Is it state DHMH or State Department of Agriculture? Who would make the call, and where would spraying occur? How long would it last? And should residents be inside when the spraying takes place? I'd like a little more information about that.
My understanding is that this will be a decision between DHMH and the Maryland Department of Agriculture, that they would be the ones, and they would be alerting me, and they would be doing it. We will try our best to notify neighbors, but some of it may begin almost immediately. This issue about whether or not one should be inside or out is a hard one for me to answer. I don't really have the recommendations. I know that typically we prefer to have our children inside when this is happening. But again, this is an EPA-registered pesticide that really does target the mosquitoes and not humans. I will try to get you more information in terms of the recommendations. But again, this may happen, say, within a 24-hour period. So it can be difficult to reach those. What I mentioned is that if there is a targeted area of concern, we will follow the CDC recommendations of going 150 to 200-yard radius around that area. And even as I've had discussions with some that if it's in a densely populated area, high-rise apartments, we would still proceed to do that 150-yard to 200-yard radius. We will protect confidentiality if it's an actual human being who has that, or it may actually just be that we see there's an area that's out of control and we identify from our surveillance that there are infected mosquitoes in that area.